Good morning, doctors. Our OBGYN concept for discussion today is VBAC, or vaginal birth after cesarean delivery, or sometimes we refer to it as TOLAC, or trial of labor after cesarean delivery, which is actually the process of attempting vaginal birth after a cesarean section, and if it's successful, then we've had a VBAC. VBAC should only be done in a hospital setting which is capable to perform an emergency cesarean section just in case there is a failed TOLAC, and it's not safe for home birth. There are several factors to consider if we subject a patient to a trial of labor after cesarean section, which should also be part of our prenatal counseling. First, the patient should have had a previous low transverse cesarean section. VBAC must be offered for moms who have had one previous low transverse cesarean section, and can also be considered for moms who have had two previous low transverse cesarean sections. There should be no other uterine scars and no previous history of uterine rupture. Third, it should be at least 18 months from the time of the previous CS. Fourth, our patient should have a clinically adequate pelvis. Fifth, the fetal presentation should be cephalic. A double setup should be available just in case there is a failed TOLAC. The hospital should be capable to perform an emergency cesarean section. An obstetrician and anesthesiologist should be present to do the CS just in case there is a need for it. And lastly, the indication of the previous CS should be absent in this current pregnancy. So what about the absolute contraindications of VBAC? First, if the previous cesarean section is a classical or T incision, which increases the risk of a possible uterine rupture. If there is a previous history of uterine rupture. If there is a history of transfundal surgery, since the fundus is the area of maximal contraction during labor, which again increases the risk for uterine rupture. If there are other obstetrical complications, such as placenta previa, if there is inadequate facilities, and lastly, if the patient refused for a vaginal birth after cesarean section. And that's it. Today, we have learned what a vaginal birth after cesarean section, or VBAC, is, what are the factors to consider performing a vaginal birth after cesarean section, which should also be part of our prenatal counseling, and lastly, the absolute contraindications of VBAC. Thank you and have a good day.